side is Dr. Paul Chasan at Ranch and Coast Plastic Surgery, and Neelam's nice enough to allow us to share her story on social media. She's 26 years old. She's 1 month after her rhinoplasty. You can see over here, if you zoom in, she had the typical Middle Eastern nose with thick skin, drooping tip, very large dorsal hump, over projecting tip. She's doing great. She has a little super tip swelling still right there, and that's what happens right about a month is when the skin envelope wants to go back to its old shape. The analogy I use is that you're taking fabric from one couch, that's the nasal skin envelope, and putting it on a smaller couch. Well, what you do is, the difference between the body and the fabric from a couch, the body skin will remodel, and that's why I invented Nose Perfect. So she hasn't had this before, but right now is when it's the important time to use this thing. So I'm gonna put this in your nose, okay? So it hurts a little bit, but I want everybody to see this, and she's filming, okay? So we're gonna put this in, it hurts a little, okay? And you put it all the way in like that. And you see how that's compressing that area. Now I'm gonna show you in a mirror. What I want you to do, it takes a while to get used to it. The first time you put it in, it will hurt a little bit, and you can do it for about 15 minutes. But I want as far as you can go, and then every day, I want more and more until you work up to an hour in the morning and 2 hours in the evening. And sometimes you have to squeeze it and adjust it and put it a little farther. Do you see that? Yeah. But you feel how it kind of clicks right in, and that preserves, see, she's tearing a little, right? And that's the first time it hurts a little. That's why we wait a month or 3 weeks to a month before we start this. And each time you build up. But we just interviewed 2 people noses that we did earlier today, and they told me how much they loved the Nose Perfect. You know what I mean? Mm-hmm. And after a while, you'll really like, because remember, you're gonna have good days and bad days based on salt and your menses, okay? You'll have more good days ahead of you than bad days.
Right.
And this will help that a lot and help shape that nose, because right now, for the first, month or two, your nasal skin envelope wants to go back to the old nasal skin envelope that you had. And we're trying to get this to conform to the new, smaller, bony cartilaginous framework.
Okay.
Alrighty?